Coffee behind
I've met you before.
A lot of money over to hepatitis, but for the last 5 months they talk to nobody. They don't take emails, phone calls.
Hello everyone, thank you so much for being here again. Some of you for the second time and some of you for the first. Welcome to the Spring 2012 Inter-CHNA Leadership Conference. We're very excited to be here again, to be here with you, and we certainly appreciate you finding time in all of your busy schedules to be a part of this with us today. I want to take a second to just acknowledge some of those folks who have been active members of the Inter-CHNA and especially played a big role in helping make this happen today. I'd like to also just point out a few guests that we have here today. Sarah Levinson. Sarah, do you want to wave your hand?
Did not expect this.
Yeah, sorry, Sarah. Sarah, thanks for being here. Sarah is with Pfizer, so you probably know that this is coming out. Chris Cogdill is here representing with some of his colleagues from Walgreens. So please make sure several regional representatives here with him, and Chris is the district or regional district manager. So thank you very much for you folks being here today with us as well. My name is Andy Robinson. I'm with the Southeast Center for Healthy Communities. We're a program of health imperatives. We are the technical assistance providers for CHNA, and we're happy to have you here today. So just a few things about the day today. When you all came in, you were able to register, and if you haven't done that yet, please make sure you do between now and your workshop. I'd like to invite Ron O'Connor up. Ron is here representing DPH today.
Thank you, Andy, and thanks to all of you who helped to organize today. It was a great experience last year, and I can see that it will be again this year. Kathy O'Connor, who many of you know, is the director of the Office of Healthy Communities in DPH and has been the champion of community health networks since their inception nearly 20 years ago. We're celebrating the 20th anniversary starting on the 19th year, probably through the 21st year. We were just talking the other day about the concept started in 1992. But she can't be here today and asked to express her regrets. And given her commitment to CHNA, I think now would be an appropriate time, given that Dave is recording this and will appear on YouTube, that it would be great if everybody could give Kathy a round of applause and She and I are both pleased about the level of coordination and cooperation that's happening here among the CHNAs in the Southeast region. And as one who's been around for all those 20 years, I've seen how the CHNAs individually and collectively have grown and matured in representing the principles of healthy communities and representing your communities and all the good work that you've done. We're also thankful that you've had the presence of mind to invite other CHNAs from other parts of the state. So how many are here from other parts of the state? If you could stand up. It's good. So we have 3 from other parts of the state. Even though this is being recorded, I am going to say that what you'll learn today is that this is the best region. If you didn't already know that, which you probably do. This is the best region for CHNAs in the Commonwealth. And there's nobody here from CHNA 7. Oh, and Stephanie's here. Because I also work with CHNA 7, which is kind of the greater Framingham area. So they're great CHNA, too. Yeah. But no, I think it's a great thing. And we're looking forward here in the Southeast to being invited to regional events in your regions, and we're just hoping that the bar hasn't been set too high for you. So that's pretty much all I had to say. I think it's just great that you're benefiting from all your good work, and you continue to draw new people into the work that you do, and that's so important. That many of you have been with CHNAs from the beginning. I see a few people here who have been with the CHNA since its inception, but there are also many new people, and that's great because it keeps the CHNAs vibrant and working. I'll leave you with that. Enjoy the day, and thank you all very much for being here.
Thank you.
So I'm guessing, would you consider yourself a company? So if you can focus on my questions, I could. This is hands-on, so you can look at stuff as we go, but this is definitely, as the 201, it's not a how do we do the basic mechanics, but maybe looking at, we talk about a concept or a strategy, let's pop online and see what that looks like, and maybe have you try out one that applies to you, but it's sort of not the one-on-one. We're doing a lot of walking through how to set things up, so that's the idea. And we're going to talk about how to really set up a plan for social success with these tools. So we'll talk about that a bit. So that sounds like we'll speak to some of your questions. And then we will look at some hands-on things on Facebook and Twitter, but definitely focusing in on some elements that are, again, not the basics, but some strategies that might be effective for you.
Federal initiatives really just try to find a good source of information. I'm sure you all have them. Who's part of a national organization that they trust on policy issues that other people might want to know about? Stephanie?
CADCA, which is the Coalition for...
A little past 10, so we should probably get started. My name is Connor Unitz. I am the Senior Vice President for New Media and Public Affairs at the Liberty Square Group. We're a Boston-based public affairs firm. I was fortunate enough to come down here in November to sit on a panel discussion at your last original meeting and talk about social media and branding, and they invited me back today. Well, obviously, we're going to talk about marketing and branding, but I want to be clear that this is not, I'm not thinking of marketing and branding in the terms of, Mad Men or some big company where you can spend, millions of dollars on an ad campaign and get your brand out there. My background prior to the Liberty Square Group, I was a director of communications at the Greater Boston Chamber of Commerce. So, it's a pretty big chamber, pretty well known, but didn't mean we had a lot of money for an ad budget. And during my time there, we significantly expanded our brand more by utilizing our partnerships and by consistent messaging than by spending lots of money on advertisement. I don't think we actually spent any money on advertising the whole time we was there. We begged, borrowed, and stole advertising, but I don't know that we spent money. And so what we're going to talk about is how do you create and manage an effective brand working within the constraints that I'm sure most of you are faced with.
You get everybody to write their congressman.
Hi everyone, as Andy said, I'm Wendy Garflip from Greater Fall River Partners for a Healthier Community, or CHNA 25. Members of Greater Fall River, CHNA 25, CHNA 22, Greater Brockton Community Health Network, CHNA 23, South Shore Community Partners in Prevention, CHNA 24, Greater Taunton and Human Services Coalition, CHNA 26, New Bedford Allies for Health and Wellness, and CHNA 27, Cape and Islands Community Health Network Alliance, have been meeting regularly as part of the Inter-CHNA initiative. The mission of the Inter-CHNA is to bring forward the voice of public health in our communities and to broaden the scope and definition of public health by providing support, education, opportunities for networking, as well as building collaboration, problem solving, influencing policy, finding and developing resources and sharing best practices that aid in promoting CHNA work around health disparities, health equity, and social determinants of health. In November of this past year, we planned and participated in our first day-long Inter-CHNA conference, in which members explored ideas about the possibilities of CHNA work in Southeast region and how CHNAs can support each other to realize these possibilities. The result of that conference, echoed by almost every evaluation we received, is the desire for continued opportunities to continue the work begun that day. A number of years ago, each one of the CHNAs encumbered $2,500 for the Inter-CHNA initiative, known then as Synergy. The funding has helped us develop and execute the Fall Inter-CHNA Conference, as well as today's event. As we move into the future, the members of the Inter-CHNA are strongly committed to continued regional programming to strengthen and support community health in our region, as well as strengthening our local CHNAs. We envision the Inter-CHNA leading us all in regional branding and marketing. We envision the Inter-CHNA in helping us develop advocacy and policy statements on varied issues for statewide and local legislators. We envision the Inter-CHNA promoting best practices in work around health disparities, health equity, and social determinants of health. We are very cognizant of the fact that each CHNA has different funding and that there is a great difference amongst the determination of needs funding that we receive. In order to continue our regional work, we need to make some decisions as to how we will continue to fund this vital and exciting initiative that we're doing not just in our local CHNAs, but as a region. As an Inter-CHNA, we have discussed a variety of ideas and would like to present some of our thoughts to you all. We would encourage you to discuss these at your tables during lunch and let any member of the Inter-CHNA know your thoughts. If you are presently sitting on the Inter-CHNA, can you please stand for a moment so people can identify you? So Inter-CHNA members, just stand for a minute. So after you discuss this at your table, feel free to approach any of the people that are standing. Thank you. We can continue to ask, so here are our decisions, here are our suggestions. We can continue to ask each CHNA to encumber a set amount of funding that would support the work of Inter-CHNA. We're concerned about this method since we know that a number of areas have limited DON funding, and the $2,500 we encumbered in the past could be way too much for their budgets to sustain. We could lower the level of funding, but that would impact on the quality and the amount of programs we can organize and the work that we can do. The other suggestion on the table is that we create some sort of formula that allows a percentage of the DON each CHNA receives to be designated to Inter-CHNA. In this way, CHNAs that receive large DONs would pay more, and those that do not receive any DON funding or a small amount of DON funding would pay nothing or less. We would welcome your input as to these ideas, or if you have any other suggestions on how to keep the Inter-CHNA functioning at this high level. Every member of the 6 CHNAs in our region come to the table as a CHNA volunteer. Many of us have positions of leadership and responsibility in related fields, and all of us care deeply about the health and well-being of the communities we represent. I know I speak for all of the members in saying that we are committed to the mission of our local CHNA and the Inter-CHNA. However, all of us balance our ability to participate in CHNA-related activities with the responsibilities and time commitments of our day-to-day jobs. Technical assistance enables us to continue to create and implement advanced, high-quality initiatives at both the individual CHNA and the Inter-CHNA level with minimal impact on our existing affiliations. Since we received the news about the Southeast Center for Healthy Communities, we are cognizant of the fact that we need to find a way to have the technical assistance we need to help keep the Inter-CHNA functioning and vital. We want to ensure that our region has both the guidance and the opportunity to design, carry out, and evaluate specific strategies that address health disparities among the populations that are specific to our region, including minorities, immigrants, low-income individuals, individuals with disabilities, and seniors. We would envision this being provided through train-the-trainer events for neighborhood-based prevention specialists. We would also support both paid staff and community leaders in understanding the significance of specific regional indicators, such as homelessness, unemployment, rates of addiction, and violence, as well as the data. The Inter-CHNA conference confirmed our sense that as a region, we can be a strong force in promoting the department's mission to direct evidence-based practices to improve primary care and preventive health services for vulnerable populations. In particular, working together as a region, we can provide a clearer message to the public as to who we are and what we do. We can also offer a richer offering of staff development and skill training opportunities to the hundreds of people in our communities who are already committed to the department's mission. Finally, we can make more effective use of the resources we currently have and expect to have in the future as the determination of needs process goes forward. We have the voice, the energy, the commitment, and the knowledge. Now we need to figure out how best to make this happen. Please think about these issues and bring your thoughts and suggestions to any of the members of the Inter-CHNA or to your area CHNA chairperson. We need your wisdom and creativity to keep our region functioning at this amazingly high level of engagement and empowerment. On a closing note, the members of the Inter-CHNA would like to recognize all the efforts and hard work of Andy Robinson. The support of all of us has enabled us to do masterful work. We could not have done any of this without his leadership, vision, and incredible talent. Please join me in wishing Andy success as he moves forward in his work. In recognition of Andy, a donation has been made in his honor to the Greater Fall River Partners for Health and Well-Being, a CHNA offshoot that is working with homeless families that are housed in area motels. Thank you, Andy. I've learned a lot from you. So we are just beginning, and all beginnings are difficult. All beginnings demand a lot of intensive thought and action from the people that are involved. So I'd like to leave you with one of my favorite quotes. You are not required to finish the work, nor are you free to desist from it. If not now, when? Thank you.
Otherwise, thank you for being here, and enjoy your afternoon.
Yeah,